Hey bestie, you want to be a nurse at Maple Hospital in Roblox, but you're lost and don't know where to start? Stay, because this almost 10-minute tutorial will save you. So when you first click on nurse, you're gonna get spawned at the locker room. This is a locker room, so if you want to change your outfit, you can come here. And if you guys want scrubs, like nurse scrubs, you go to Maple and you can find here, but you can also search by term or ID. So if you want something that's in the marketplace of Roblox, you can get the ID from it and put it here, or the name. If you go this way, there's pretty much a lot of doors. There's 3 doors. The door that you want to come out is this one right here. This will lead you to all of the rooms and all that, but for claiming patients, you have to go outside to the lobby. So you just come from this side to this side and you go through this door. There's also another door on the other side, so you can also go through the other side. So usually patients will spawn here. There's none right now, but look, they're checking in some patients. So we're gonna wait for that girl to be done with this girl so we can claim her. She's going to sit and we are gonna claim the patient. Now it says take patient to ER room. So this is different. You're gonna grab your wheelchair. If you don't have it in your inventory, I'm pretty sure you can get in there, like right here. Yeah. Okay, so let's go back. For emergency rooms, there's 2 different rooms. There's emergency rooms and normal rooms. The emergency rooms are this way, and our normal rooms are the ones here. This one's right here. So all black, that row. And here are some of the rooms. So you're gonna put the patient in one of these rooms, I guess. Usually, I feel like since the update of Maple Hospital, there's some bugs here. So if she doesn't accept this room, you can take her to like a normal room, and if she doesn't accept that, go to Lavier, and probably Lavier room will accept it until any room accepts the girl. Because I don't know what's happening, honestly. So this is like a normal room. Let's see if she can. No, she still doesn't want this room. I'm pretty sure, I really don't know why this happens. If someone knows, please let me know in the comments, because this didn't happen before. We're gonna go to here to Lavier and delivery. Maybe she wants that room. Just go to all of the rooms until one. Okay, I didn't get to see what it says when he was playing, but usually when you get ER patients, they're gonna show you like their notes. So here they say that they gave him an EPI and they rescued her from cardiac arrest. There's the vital signs and all that, and at the bottom it says the status of the patient, which is dizzy and nervous, suspected analeptic shock, and a candy that contained peanuts. So that's basically explaining you what's happening to her. So you start helping her with that information. Oh, I didn't see that. But okay, that's gonna pop up and you can read what she has. As far as I didn't read, we don't know yet what she has. So okay, so pretty much you have to do what it says here. If you don't have this here, just go to tasks in the right corner, task, and it's gonna show you there. So it says grab a patient gown from the supply room. The supply room is right here. So we're gonna get into the supply room. Here you can get everything, basically, pretty much. So the gowns are down here. So they're here. So you're just gonna grab it and you're gonna bring it to her and you're just gonna click E. Now it's asking you to take the temperature. So we're gonna take temperature. We're gonna check heart rate. If you do not have these things in your inventory, you can find them in tools right in the right corner as well. You can search like the things that you need for it. If you don't know the names, just go to all and do work, and they're pretty much here. Now it's asking you to grab a vitals card in the hallway. So you're gonna go out to the hallway. I'm in the Lavier room, but if you're outside, you can see it like here. I'm gonna show you guys where it is. In this part, the vitals card is, they moved it, but oh, it's right here. So the vitals card is right here. But if you're in labor and delivery, and it's gonna be probably here, it's right here. So just find this card. You're just gonna grab it. If you see one in your room and you cannot use it, it's because you didn't grab it, so it's not yours, it's someone else. So you're gonna put it like really right next to the bed, gonna click, and then you're gonna wait until it's E, and you're gonna press use, and it's just gonna get in her arm. You don't really have to do anything here, and just wait until the blood pressure is done. Now it's asking you to use a computer to report vital signs, so you're gonna walk to this computer. Is in every room, so you don't have to worry about that. You're gonna click E, and There we go. It's putting the vitals right here. So now this is asking me to get saline IV for her. So we have to attach the saline IV. If you don't know where the IV is, it's literally this pole right here with this two bags. You just get close to it. You click it and then saline. You grab it and then you're gonna attach it to her. And then it's asking you to put an oxygen mask on the patient. So when I first started playing this, I didn't really know where the mask was, but it's literally right here. So just walk to this like green square and there it is. Now the doctor has ordered treatment, so we have to check the computer again. It's asking for anti-medic. So we have to go outside, not in the bowl. We have to go outside to one of these stations. That's Quixie's med station. You have to find it. It's also outside in another part of the hospital. It's always where the desks are. So here it is. So you're gonna walk to it and they ask me for anti-Semitic, so we're gonna click on that and then dispense. And there you have it. So, and we give it to her. There she goes. Okay, then the doctor has asked for more treatment, so we're gonna sign in. He's asking for allergy relief. So, okay, so now the pharmacy has received the order and will be ready soon. To get this order, you have to walk to this tube. There's probably none in the delivery room. So if you don't find it here, yeah, they don't have it here. So we're gonna go outside. It's gonna usually drop in this little basket, but we have to wait until it drops. Oh, there we go. So you accept this and then you grab it. Now let's just give it to her. And we're gonna let the patient sleep. So we have to go outside. We have to go outside and just chill. Now she's done sleeping and the patient has triggered their cold light to go check on them. It's gonna say here, but it's also gonna do like a little light in there. You can see it outside of the door. There it is. So you're gonna walk to the patient. And now it says disconnect her from the IV. So that means that she's going home. So we're gonna disconnect her. You just have to click E and that's it. And it says print discharge papers from printer. So you're gonna go find a printer. I don't think there's one here. Oh yeah, there it is. Okay. So you're just gonna walk to a printer. Usually they're also at the desks. So you're gonna print the discharge papers, not consent form, discharge papers, because we're discharging the patient. She's going home. It's gonna pop up here. You just pick it up and then you're gonna take it to the patient so she can sign it. She's signing it. She's gonna give it back to you and you have to put it in this box, which is always at the desks. So you just walk to it and put file and we're just gonna send the patient home. So we just say send home. And that's it. You got 20 XP. That's amazing for a nurse. And that's pretty much what you do as a nurse. You just take care of the patient, basically do like all of the indications that the game is telling you to do. If you don't find something, you can always walk to different supply rooms because not all of the supply rooms has everything. So if you don't find something at one supply room, just walk to the nearest other supply room and you're probably going to find it there. Usually they're going to also ask you for crackers. So the crackers are here. When I was playing it, I never found the crackers. So I had to pull a TikTok tutorial for where the crackers were. And if they're asking you for food, you just open the fridge. And there's pretty much that. Here is the puke bag also. This isn't the supply room because other supply rooms are different, but I just want to show you what the things look like. Here are all of the samples. If they're asking you for samples, here's saline, here's blood samples, swabs, urine samples. Down here is the patient gown. Here is the lotion because sometimes they ask you for lotion as well. But if you don't want to come over to the supply room, or if you don't find the lotion at any other supplier room, you can go on tools and also find it here. If you guys don't find anything, you can also try to find it at the tools. Not everything is here, but maybe if you don't find anything, it's probably here as well. So I recommend that too. Oh, the gloves and masks usually are at the rooms. So if you want a glove, here are the gloves. And if you need a mask, because sometimes for doing samples, it requires you gloves. But yeah, that's pretty much how to be a nurse. If you guys want any other tutorial on any other of the roles here at Maple Hospital, let me know in the comments. Bye guys!